Thank you, Trey. I'm here with Dr. Jack Lee, a eye specialist, a glaucoma specialist, and a doctor at the Victoria Eye Center. Thank you for joining us today. We're so thrilled you're here.
Thank you, Karina. The pleasure's all mine.
Absolutely.
Yeah.
As you know, we're still amidst the back-to-school season, so parents are rushing to get their eye examinations to get ready to back in the classroom. Can you tell us why it is so important for parents and children to receive eye examinations?
That's a great question. Eye diseases may be silent until the very late stages. So it's important for people to be routinely screened for any eye conditions. This is especially important in children, as children often have a difficult time communicating their needs and communicating any issues. I work in a disease called glaucoma, in which the disease is largely silent until the very late stages, and oftentimes a routine exam catches the disease early on, and the same is true for children. Oftentimes, catching disease early will allow early treatment and addressing of the issue and better outcomes.
And how can parents identify these issues early on?
Well, as we talked about, children have a hard time kind of describing what they experience, so often falls on teachers and kids and parents to be vigilant. Squinting, tilting of the head, holding books or tablets or phones nowadays very close to the face are some signs. Difficulty concentrating, being more socially withdrawn, and doing more falling grades at school are some signs to watch out for.
Okay. And what are some treatment options available?
Yeah. Well, glasses and contact lenses are more stylish and safe than ever, so those are certainly great options for children. But I always say prevention is the best medicine, and therefore routine eye exams I typically recommend for all school-age children to receive a routine eye exam. Can catch issues, for example, nearsightedness or farsightedness early and lead to earlier treatment and correction.
Absolutely. And how often do you recommend children and parents go receive these eye examinations?
If there's no other ocular issues or ocular diseases, typically a routine exam every 1 or 2 years is sufficient. But of course, if an issue is detected, a dedicated eye provider will follow the patient much more frequently.
Absolutely. And where can people in Victoria go see you for examinations, and just your contact information if people would like to get in contact with you?
We are located right here in Victoria at the Victoria Eye Center, and our website is up on the internet as well. You can easily Google us. We're at 107 James Coleman Drive, and our number is 361-578-0234. And we're accepting new patients.
All right, that's amazing. And real quick, one last question. Sure. At what age should children start receiving these eye examinations? What's the recommended age?
Absolutely. Some people are surprised to find that their first eye exam came at earlier than 6 months of age. Pediatricians and other providers routinely screen children. I typically recommend that a dedicated eye provider, an optometrist and ophthalmologist, examine children before they're about school age, right about school age.
Okay. Well, thank you, Dr. Lee, for joining us so much once again. And everybody watching at home, don't go anywhere. Coming up, news to know before you go.